Hi everyone, I am Gretchen Bailey with Optometry Times, and I am joined here today by Karen Walsh, who is Professional Education Team Leader and Clinical Scientist at Center for Ocular Research and Education, or CORE. Did I get that correct?
You did. It's a mouthful and you're spot on. Thank you, Gretchen.
And thank you for joining me today, Karen. We are going to be talking about mask-associated dry eye with everyone, or hopefully everyone, wearing masks for the last several months due to the pandemic. We are seeing that patients are experiencing a bit of dry eye, and there's new information on that. And you are calling it MADE, which is mask-associated dry eye. Can you tell me a little bit about that?
Absolutely, and thank you very much for having us on to share this information. So mask-associated dry eye was first actually coined by an ophthalmologist out of his clinic in the US, but we are all within the profession seeing greater increasing reports of patients coming in and just being aware that not only is the mask a little bit strange to wear, but their eyes are feeling uncomfortable as well. So mask-associated dry eye is the descriptive term that explains or gives a name to those sensations. It's a very simple one to understand. What's happening typically in a mask that is not very tightly fitting against the face is that exhaled air that has to go somewhere is being kind of channeled up and out of the top of the mask. So what that means is repeatedly as the mask is worn for a length of time, that air is going up over the ocular surface and it's causing our tear film, which is already delicate and got a complex job to do, it's making it evaporate more quickly than it should do. And that happening repeatedly over time leaves the surface of the eye getting dry. So people are finding that they're getting dry and uncomfortable, irritated eyes behind that mask.
So you said for masks that aren't tight fitting, are you finding a difference from, say, an N95 to people who wear a bandana as opposed to like an N95 or even a homemade mask? What have you found with that?
So, I mean, you've got a couple of different types of masks you're mentioning there, and you've probably also got a couple of different sets of groups of people and how long they're going to be wearing their masks for, which also play into this. But particularly where this will be happening is often behind more of a cloth mask where you have that little air gap. And so repeatedly breathing behind it. And really that's the one that the majority of us need to wear when we're out and about in public places or shopping. So it's a very simple thing to recognize if it's happening to you. And thankfully, it's a really simple thing to take some very practical tips that eye care professionals can help to advise their patients on to help alleviate that problem. So there's some good news here. First of all, it's important to recognize it. And then there are some tips that I can share with you that practitioners can share with their patients to help make things feel a little bit better.
How will a practitioner understand if this is mask-associated dry eye as opposed to an exacerbation of a patient who already has the condition?
So that's a great question, Gretchen. So there are a couple of groups of patients that we would like people to be on the lookout for related to the MADE condition. If you already have a patient who has diagnosed dry eye disease, they may be coming into you reporting a worsening of their symptoms. So they already have something going on. They may feel it's worse when they wear their mask for an extended period of time. For a patient who doesn't have that diagnosis and does not have dry eye to start with, they actually may be coming in and talking to you for the very first time about those irritated eyes that are feeling red or uncomfortable. They may even be talking to you about variable vision, because if your tear film is disrupted, of course your vision is disrupted as well. So an eye care professional has to be on the lookout either for worsening symptoms in an already diagnosed patient, but I think one of the key points here in what is a simple situation to manage, but one of the key points is to be really proactive and ask your patients, all of them, when they're wearing their mask, how do their eyes feel when they're wearing their mask? A patient may not tie up the sort of just general sensations that are uncomfortable with mask wearing with the fact it's causing their dry eye or new dry eye symptoms as well. So proactive inquiries from the practitioner is a really useful thing to do at this point.
That's a good suggestion. So you mentioned that you had some tips on how to prevent this, and I'm assuming that one of those tips is not to skip wearing the mask.
Absolutely. So you've started with the most important and fundamental. Nothing that we are trying to alert people to here is a reason or an excuse to stop wearing the mask. That carries on. It's incredibly important for all of us to do our part to slow down and prevent that transmission of COVID-19. That makes perfect sense. But to continue wearing the mask as comfortably as possible from our eyes, from that point of view, you'd like a mask that's going to be fairly snugly fitting around the face, but particularly around the top edge of the mask.
Right. And that's where patients are also finding, if they are glasses wearers, that they may have the fogging problem. Those are a lot of complaints I'm seeing.
And it's incredibly irritating, isn't it? Absolutely. I mean, I was wearing sunglasses the other day, and you're walking around, and every single breath that you take, if that mask is sitting wrong, if your glasses or sunglasses are not aligned, you're steaming up. You
Right.
can't see. It's uncomfortable. And in fact, actually, the steaming up or fogging of spectacles that happens is really one and the same process that's also happening with mask-associated dry eye. It's still that exhaled air that's coming up behind the spectacles.
Right.
So the snug fitting mask actually will help to solve both of those issues. If you're wearing a mask for a prolonged period of time and you find it helpful, even lightly taping that top edge of the mask with surgical tape, some people do find that makes a big difference, because what you're trying to do is direct that exhaled airflow down and away from the eyes. So your first tip is a better fitting mask, or paying attention to close fitting mask. Now, if you're getting symptoms from mask-associated dry eye, and particularly having to wear that mask for prolonged periods of time, then using lubricating drops would be another simple step to help alleviate those symptoms, make the eyes feel more comfortable. Speak to your eye care professional, your pharmacist. Both of those are very well placed to give you good advice on the most suitable drop for you to go and use. So that's a good tip. And then one of the other things that we'd like people to be aware of, pay attention to, is, of course, we're having to increasingly use masks in situations that are already quite drying for our eyes. And what I mean by that is, if you think, if we're going back into our office situations potentially now and having to sit with a computer in an air-conditioned environment, but
Right.
also wear a mask for that length of time. Now, you're going to need to keep the mask on, but be aware that air conditioning is drying for the ocular surface. Staring, of course, at digital devices changes our blink pattern and is drying for the ocular surface. So trying to limit the time that doing those tasks in those environments while wearing the mask is a very important thing to do as well, where possible.
Excellent. Those are all really good tips. Do you have any specific suggestions for eye care practitioners in treating these patients? I mean, obviously, offering these tips to patients, but anything else clinically that doctors should be thinking of?
So I think taking the step back to the beginning of that eye examination appointment and having that proactive mindset of asking and inquiring how eyes are feeling just now on a routine basis, not something we've had to think about before. So this is new for our new COVID practice world that we face, would be an important tip. And maybe sharing with patients the information about why it's happening, reassure them that it's not serious, and of course pass on those simple tips that they can take themselves to help alleviate the problem. If they go to covidifax.org, we actually have an infographic that's available there, currently in English, in one language, actually soon to be available on there in 21 further translated languages.
21.
21. Now,
Wow.
eye care professionals will be able to download that free and use that in their practice with patients, and they may well find that information very useful to be able to translate what they're trying to get across and have their patients maybe take that home with them to take the advice away with them as well. So covidifax.org for the infographic, and coming in a number of different languages soon.
We will put a link up to that and share the infographic as well.
Thank you.
This was very good information. I know that a lot of people are finding problems with, as we were mentioning earlier, sunglasses or spectacles, and even if you're a contact lens wearer already, all of that exhaled air. So I'm glad that we have some good information out there. Karen, thank you so much for joining me today.
You're welcome, and thank you very much for your time, Gretchen. I appreciate it. Thank you.